Okay, so good afternoon, everyone. My name is David Oshinsky, and I'm pleased to welcome you to today's CFF Back to School Town Hall, the fourth in our virtual Town Hall series, providing the latest information to our CF community. Just a few housekeeping comments. Please make sure to keep your microphones muted during the presentation to avoid disruption. You can enter any questions you have using the chat feature, and we will do our best to answer them, time permitting. If we cannot get to your question, we'll be happy to follow up with you after the presentation. Today's town hall will be recorded and made available after the call. So now it is my pleasure to introduce today's panel. Please help me welcome our distinguished physicians. First off, Dr. Maria Dowell, Director of CF Center at Ann and Robert H. Lurie Children's Hospital of Chicago. Dr. Terry Laguna, Division Head Pulmonary and Sleep Medicine and Associate Director of the CF Center at Lurie Children's Hospital. Dr. Kim Watts, Director of the CF Center at Advocate Children's Hospital. And Dr. Louise Giles, Director of the CF Center at Comer Children's Hospital at University of Chicago. So without further ado, it is my pleasure to invite Dr. Terry Laguna to unmute herself and start the presentation. And I will begin sharing my screen right now.
All right. Thanks, David, and thanks to the Illinois chapter of the CF Foundation for inviting all of us to participate in this important discussion. I'm honored to be a part of the panel, and hopefully we'll be able to address a number of your questions and try to at least give you a foundation and a structure to start to think about some of the important key concepts in getting your kids back to school. So the way that the presentation or the hour is going to go is each of us is going to give a short, just brief presentation using a couple of slides or props to really just give you an idea of some of the things that we are thinking about and some key messages that we would like you to hear. And then we're going to take turns. We've grouped the questions that we have received from you guys already. We've grouped them into 4 themes, and then each of us will take one of those themes and try to go through and at least provide an answer to the majority of the questions we've already received. So we will do our best to try to get to as many as we can. And then as David said, if we have questions that are coming through the chat box, we'll try to get through those as well. So just so you kind of know what to expect. So, so that's me. Go ahead, David. Next slide.
Sorry.
So I wanted to start with just a couple key messages for everybody to hear and try to help put into context all the information you're going to get today. So the first one is probably the most important one, is for as much as we would like to, your CF Care Center cannot dictate school board decisions. So we cannot tell your schools what to do. What we can do is work with you to try to provide a safe return to school, whatever that looks like. So the second point is really what our goal is. So our focus is to allow children to attend school safely in whatever form that is, while minimizing the risk of COVID-19 infection and transmission among all members of the household. So that is really what we're striving for. Communication with your CF care teams is critical. Every one of you probably has a unique circumstance, a unique story, a unique situation that's going to warrant individual discussions. We are all aware of that, and we are open to having individual conversations to help you decide what is best for you and your family. Next slide. Okay, so I'm going to basically give you 2 perspectives. And in our world, as first pediatricians and then pediatric lung doctors, there are 2 important societies that we get a lot of our information and direction from. So the first is the American Academy of Pediatrics. And this is basically a society of 70,000 plus pediatricians across the country. So some of you may have already heard the AAP put out a statement, which I have just typed in right on this slide. So the AAP strongly advocates that all policy considerations for the coming school year should start with the goal of having students physically present in school. There's lots of reasons for that. I think people will all agree that physical presence in school is the best way to learn. However, That was not a standalone statement. That was a statement with a number of caveats that I'm going to go through below. So there are a couple key points to remember. The first is that science should drive decision-making on safely reopening schools. Every state, every community has a different circumstance in terms of how much virus is spreading in the community. All of those unique situations need to be taken into account. So the science should really drive how schools open. School policies should be flexible in responding to new information, meaning if a decision is made to start in-person learning and then the circumstances in the community change, school policies have to be flexible. They have to be willing to pull back. They can even open up more if viral transmission goes down. So having the ability to flex and be adaptive is key to this entire situation. Strategies should be adapted in response to the level of viral transmission in the school and throughout the local community. In Chicago and in Illinois, we have a very low positivity rate and a very low number of cases per 100,000 people, which allows us to have a little bit more flexibility. That's not the case for certain pockets of Illinois and other places throughout the country, and it's going to change. So strategies have to be based on the science and the amount of virus in the community. Special considerations and accommodations to account for the diversity of youth should be made, meaning children have specific circumstances and unique situations that need to be addressed individually. And just for everybody to remember that any policy, any COVID-19 policy put into place for school, the policies are intended to mitigate, not eliminate the risk of transmission. So there will always be a risk. So no matter how much care you take, the risk is going to be out there, and that's something that we all have to keep in mind. Next slide. So the other kind of pieces the American Academy of Pediatrics stresses are physical distancing of at least 6 feet is recommended. However, that may not be possible without limiting the number of students. And the recommendations are also going to vary by age. So little kids, you're going to have trouble keeping apart. Older kids, it's going to be much more feasible. They do recommend that physical distancing is mandatory for all adults. Anybody within the school that's an adult needs to abide by the 6-foot distance. The recommendations are going to vary by age group and are developmentally based. So young kids may not be able to physically distance and may not be able to wear a face covering. In those situations, can you go outdoors? Can you limit class size? What can you do in basically to take the place of the physical distancing and a mask? Schools should have a policy regarding symptom screening and what to do if a student or school or staff member becomes sick. So there's got to be a plan in place of what happens if somebody in the class tests positive, what happens if the teacher tests positive. So those are things to think about. Go ahead, David. And this is my last slide. So the last piece, the other society and foundation we listen to is obviously our Cystic Fibrosis Foundation. Some of you probably already have gotten wind that the CF Foundation on the national level is having a CF Back to School gathering next. It's on July 30th at 7 p.m. Eastern Time. That was just released today. So this will continue to be discussed on a national level. So what is out there now is on the cff.org website, and these are some of the key concepts. So the CF Foundation stresses that remote learning remains the safest option, but ... of course, if you're considering in-person learning, talk to us. So talk to your CF care team to discuss options and the steps you can take to reduce the risk for you, your child, and members of your household. And these are the same recommendations about 6 feet of physical distance, face coverings. We'll hear more about that in a little bit. Frequent hand washing and avoiding large gatherings. The same advice you've been hearing over and over again. You need to consider the COVID-19 activity in your community, and you need to communicate directly with school to your school individually to understand the preventative measures and plans they have in place. Each school is going to be different based on their circumstances, their space, the number of students they have. It's going to be very different. Go ahead, David. So that's it for me. So that's just a few of the basic kind of key concepts to keep in mind. And I'm going to hand off the baton to Dr. Watts, who's going to talk to you more about data.
Hi, everyone. Thank you so much for having me today. Just before we go on to a couple graphs, I just want to make sure that everybody recognizes that this is introducing the data from the CDC and the CF Foundation is really meant to just be a brief look at the data and is by no means comprehensive. It's just a snapshot of information that pertains specifically to school-aged kids and those that are younger. The numbers presented are meant to clarify and elucidate the burden of disease in the children, and we understand that these numbers specifically will vary by age, location, comorbidities, but we just wanted to present some data as it relates to specifically to the pediatric population and how that will inform decisions going forward. Next slide. Okay, so this information is from the CDC website. I encourage anyone to go to the cdc.gov website if they want to evaluate this data independently. I put it into a graph form, but it is updated weekly. And there are many different ways to look at the individual data by age, by location, by sex, by comorbidities, and it's really easy to navigate. And I think it really is the best source to see what the numbers look like at a national level. As you can see, I played with this graph a couple times, and because of the burden of disease is so disproportional in the older population, it's hard to appreciate the actual numbers. I made a pie graph and I only got one color on the pie graph with one line representing everybody else. And that sort of speaks to how the burden of death from disease is skewed towards the older population. But I want us to break down the numbers specifically that we have to date, starting in February of 2020 from the CDC, and the most recent was mid-July data. So what we see are these are deaths from and attributed to COVID from the CDC data set. And what we see are the bars you'll see, the age breakdowns are on the bottom, the x-axis has the age breakdowns and deaths are on the y-axis. So those are hard to read, so I want to just direct your attention to the box. What we have as of this last reading from the CDC is in the United States, there's been 9 deaths from COVID in patients less than 1 year of age, 8 in patients from 1 to 4 years of age, 14 patients from 5 to 14 years of age, and 157 patients from 15 to 25 years of age. And then 25 and older accounts for the remainder, which is at this time was 121,186. The reason I specifically broke off this data is because when we're talking about school-age children, 25 and under. And okay. David, do you have the screen back up?
I think we lost David too. Oh, there he is.
All right. Okay, thank you. And so then we'll, so the Cystic Fibrosis Foundation weekly sends data to the centers about the COVID positive tests, COVID positive patients that have been reported to the CF Registry. For everybody on the line, just remember that the CF Registry is an amazing database that's maintained by the CF Care Centers and the Cystic Fibrosis Foundation that really allows us to get robust data on all of the patients. Currently, there's 31,199 patients in the United States in the CF Registry. To date, they've had 90 positive COVID patients reported to the CF Registry. This breaks down to the following. 27 of those patients were classified as pediatric patients and 63 were adult. Of those 27 pediatric patients, 7 have been hospitalized with zero deaths recorded. On the adult side, we've had 21 hospitalized, 16 of those were with advanced lung disease and 5 were post-lung transplant, and each of those categories resulted in 1 death. Next slide. So we'll be going to talk a little bit more about what that data means and how it informs our decision about school, but now I'd like to pass it off to Louise.
So I don't have any slides to show, but thank you so much for inviting me to this amazing panel and have a discussion about what are important for our patients and our families with cystic fibrosis. There's a lot of myths going around. So one of the things that the CDC has recommended, the World Health Organization has recommended, and there's been a lot of discussion is about wearing masks to try to prevent transmission of COVID. And we know that if people wear masks, we can reduce the transmission by a significant proportion and keep the economy going. There's a lot of myths out there, though, about wearing masks. People feel that you can't wear a mask if you have an underlying disease. People are claiming a lot of other different things. So when I went to the internet to find out what are some of the myths that are out there? One of the most common ones is that I won't have enough oxygen. The mask will prevent me from getting enough oxygen into my body, and then bad things are going to happen to my body about that. And we can dispel this, we can dismiss this one quite easily by stating that we wear masks in the hospital. Surgeons wear masks while they're doing surgery. They're not losing oxygen. They have to wear those masks for hours on end while they're performing surgery. And there's no reason for masks to be diminishing the amount of oxygen. Many healthcare workers have gone onto YouTube and are producing videos showing them wearing a pulse oximeter without a mask on, and then putting the mask on and showing that the numbers don't change at all. And that's the amount of oxygen that's getting to your tissues. So the mask does not prevent you from getting oxygen while you're wearing it. The other myth out there is that, well, I'm going to have a buildup of carbon dioxide because when I have carbon dioxide, because we breathe that out, and I'm going to rebreathe that back in. And again, the masks do not retain carbon dioxide. You will not breathe in more carbon dioxide that's going to harm you. The most of the air that you're going to be breathing in, even with the mask on, is still the 21% oxygen, which is what you're supposed to be breathing in. So no, you will not get a buildup of carbon monoxide. If you sit there and you think about our healthcare workers who've been working in COVID wards where they have to wear the mask continuously for 12-hour shifts or even longer, they're not building up carbon monoxide and they're able to go home at the end of the day. Another myth that's out there is that you might get carbon monoxide poisoning, and that's not how you get carbon monoxide poisoning. Carbon monoxide is not something that you expel in your breath. Carbon monoxide is not something that we normally breathe in your air, especially if you're out in the open. It's produced by diesel exhaust. And so that's just not something that you're going to retain in your mask. The other myth out there is if you have an underlying lung disease, you're not going to be able to breathe properly. And that's a very, very small population. Most people with underlying lung disease can safely wear a mask. Now, there's certain populations that we would sit there and say, no, a mask is not a good idea. And you can and that is broken down to those who cannot take off their own mask independently if something were to go wrong. So that would be a very young child, under the age of 2. That would be somebody who has got severe developmental delay and cannot don or take off or populations where we're sitting there saying they do not need to wear a mask, but everybody should wear a mask. If you sit there and you think about it, if you take a little diaper off of a baby's always going to pee, right? And if you sit there, and any of you have had little boys, will know that the minute you take that diaper off of a little boy, that pee is going to hit you, right? And then you put the diaper over it. Well, that's what the mask does. The mask just covers your breath from hitting other people. So if we've got ourselves covered up, then that breath it's never going to be 0%, but it's the best chance we have of preventing virus from moving on. So I actually have a few ideas about masks. The most important thing is that the mask is comfortable and the mask covers your nose and your mouth. We all see people with this mask. This is an N95 mask. This is meant for healthcare providers when they're treating COVID positive patients. This comes up to a very tight seal around. You cannot, and this is the one where you see where people's faces are marked up, but it's a very tight seal. No air can come in or out except through the filters within the mask itself. This is the one that we wear for COVID. You do not need to wear this in any other place than if you are a healthcare provider working on a COVID ward, or if we are taking care of people with other infectious diseases like Ebola or TB. They're saying they can't see me. Somebody said that. So this mask is the one that you do not need to buy this. You do not need to spend the money. Save this one for healthcare providers. Other masks that you might hear about are procedural masks. This is one that's commonly used by surgeons in the operating room. It has a mask and it has a clear visor on the top. Again, you do not need to use this one. This one's special for procedurals. It comes out like this, and then there's a face guard on top, and surgeons commonly wear this in the operating room to prevent their face from being splashed on. The next ones are procedural masks. They usually come in yellow or blue. It doesn't really matter. These ones you can actually buy at CVS or Walgreens or whatever. These ones are nice because they expand out to try to fit your face. They have a metal nose clip in there so you can press it up, and you can just put it around your ears and down below your mouth. Now for eyeglass wearers like me, you might say, well, it fogs up. So what I do is I just tuck it up here, make sure my glasses go on top, and then it usually doesn't fog up at all. The most important thing is when you've got it on, you keep it on. Now these you can buy, but probably that's sometimes a waste of money. We wear these in the hospital when we see patients, is to get cloth masks. And I have a whole bunch here of cloth masks to show off. The nice thing is just to get a mask that's got 2 layers of fabric. So you have to have a minimum of 2 layers. This has got a back layer and a front layer. And when you put it on, again, this doesn't have a nose clip in it. So you just tuck it up nice, put it around your ears, pull it down, make sure I put my glasses on. And this is absolutely fine. This is the type of mask that people are talking about wearing. And there are all kinds of different ones. You can make them, you can have friends make them, you can actually order them. There's some who are like doing custom made ones, so you can get like 4 masks for $25 with your own design on them. So you can sit there and match different things, but this is one. But you have to make sure that it covers up nicely, that at the side it's tucked up properly. And I've got, I have these as elastic ear things, but you can get tied ones as well. I just prefer the ones behind my ear, so that's a personal preference. But whatever works, works. You can even get cute ones for kids. So like sometimes you can become a cat for the day and just wear the cat one. Again, you just have to make sure that it covers things up. Or as I said before, you can get one custom made. So we had some custom made for a few of us, and I'll do more. This one, I found a very nice, beautiful drawing for cystic fibrosis. It's lungs, and it's got purple, and it's for CF. So we're going to do these ones for our clinics. But again, this is quilted. They come in different sizes. This one barely fits me, so I might get one a bit larger. But again, it has quilted second layer, so 2 layers for sure. You can get really thick ones with nose clips. This one has a nose clip. It has a space for a filter to be put in, which is excellent. But these ones tend to be heavier, and because they're heavier in the summertime, it's hard. And because of just the heat and the humidity and stuff. So this one I'll probably save for the winter time. But again, it goes over, and it has a filter that you can take in and out and wash and reuse multiple times. The ones that we have to be careful about, though, are these ones with, so this one is one that has an exhalation valve in it. You can use the one with exhalation valves, but these ones are not as good because of that valve being there. If you have one with a valve, you have to make sure you have a filter behind it. And there's the filter there. If you don't have the filter in place, this is useless. So actually at our hospital, our family members who come in are not allowed, and we're not allowed to wear one with a valve in, because you just don't know whether the filter is in place. This is meant as an exhalation valve. And then there's other ones out there. I do not recommend these. This is a scarf that is meant to double as a mask. So it's a scarf, and then attached to it, it has a mask that you can put on when and wherever you want it to. The problem with something like this is you have to be wary of the material. This is more polyester, so you're going to sweat more in it. The other thing is it's very, very thin material, and even though there's two layers there, it's not that great. You want it to be more, you want it to be a little bit thicker. So if you're putting on a mask, or your child's wearing a mask and they're feeling uncomfortable, just check the fit. You might need to go a size down, you might need to go a size up. And then you sit there and you think, let's see, where was that other one that I like to wear most of the time? I just threw them all down here. That doesn't matter. I'll put this one back. You haven't seen this one yet. This is from Canada. Anyways, so if you just have to make sure that they fit and they're snug tightly. This is not wearing a mask, and that is not wearing a mask. The mask has to be the whole way up, covering nose, down below the mouth, and that's what you do. But what I tell people is look at the material, look at the thickness. If it's not tolerated, then try something different. But everybody should be able to wear a mask. I'm going to pass it on to Dr. Dowell now.
Make sure I'm on. Oh, I am. Hello, everyone. That's a great demonstration. Thank you so much, Dr. Giles. And I will echo the comments that it is an honor and a privilege to join everybody here and to see everyone so interested in having this conversation. It's important that we keep connecting like this, and I appreciate everyone's time. My portion of this is to really kind of touch upon the idea of the chase for the COVID-19 vaccine. And I will say it seems nearly every day, every other day, there is something new and different. There's something to keep your eyes out on, and occasionally it's a little difficult to keep up. So the first thing I'd like to say is normally in any other time, vaccine development can take years to decades. I think that is safe to say. This time, there has been a certain sequence of vaccine development steps that have aligned in a much quicker way than other vaccine development had in the past. And that's not cutting corners, and I'll talk about that in a minute. It is just trying to get the resources and everybody engaged to move it quicker. So generally, again, that would have taken years, and we've gotten to this point in months. So even though there's some very good science out there, there's still no guarantee yet for a date, a time, a deadline. It's going to evolve in a safe, efficient, and tested manner. And we need to respect that because you do not want something out there that hasn't been tested for efficacy, okay? So many of you probably heard there's some funding for the government to start manufacturing vaccine before, actually an interesting thing, before the trials are over. The US Department of Health and Human Services and the Department of Defense have reached an agreement about a $1.9 billion agreement with Pfizer and a biotech company, BioNTech, to develop an experimental coronavirus vaccine that's expected to begin, I think, phase 3 trials by the end of this week. They're doing something that's kind of risky, and other companies are doing this as well. And so you may see this at-risk vaccine manufacturing or production. What that really means is they are starting their vaccine manufacturing while it's still undergoing testing so that it can be delivered faster. So that's a high risk for these companies. And they want to make this work if it can, and to be available as quickly as possible. So a lot is happening and a lot is moving forward, and a lot of resources are going into making this happen. It may seem to you like, why don't we have this yet? Where is it? This is already really, really fast in the vaccine world, and I want to reassure you that it is moving forward. I mentioned the Pfizer company. They're ramping up their production. They're going to get moving forward. There's another company in a paper that just came out in one of the medical journals that we keep our eyes on. It's called The Lancet. And it's a study out of Oxford who's partnered with another pharmaceutical company, AstraZeneca, and they have a study that is quite promising because it elicited very strong immune responses to the first phase of their vaccine. And so the big question is, it should work, but the big question is, will it work? And they are expanding and doing trials around the world, and soon to expand to the US. That will be a very big trial to test this, because it does have to work across populations. It can't be terribly handpicked. It's got to work for a lot of people. So they too are producing the vaccine in this at-risk model of production prior to the final word in order to have it available as quickly as possible. So a lot of things still have to come together. Let's see, as quickly as possible. You have probably seen out in the news sources that maybe as early as the end of this year or early next year, a lot would have to happen perfectly timed, and the data would have to come back from the trials and be undoubtedly, positive, I think, to have that happen. It's not unheard of. I think of, it just seems to me it might take a touch longer than that. I will say some things that have come up are they moving so fast because they're cutting corners? Is this going to compromise safety? And enough experts, I think, have voiced their opinion to reassure us that they're not doing anything different. They still have to go through the steps. And again, it's cutting through the steps to make sure that the support and resources are moving this forward like they need to. There are checks and balances, there are regulatory reviews, data safety monitoring, that's all happening just quicker. Ethical committees are heavily involved in this. So no shortcuts. They're going to observe the safety and regulatory requirements and push this out as quickly as possible. So I encourage you to just keep an open mind and keep your ears open for how that is moving forward and how we can all be a part of it. That's the biggest thing on the vaccine. Those two companies I mentioned aren't the only two. There are at least 3 more that are really pushing forward. And to be honest, I think I could find quotes of anywhere of 100 plus, maybe up to 130 candidates around the world that people are considering testing. So this is really remarkable to watch evolve. And we don't have an absolute answer yet, but it's certainly moving through the phases that are required to have this be a safe and effective way for us to get control of this. And we will need it. We will need it. I will stop there.
Thank you, everybody, for the presentation. Now we'll move on to our questions and answers. I think we're starting with Dr. Watts to address questions on return to school that were submitted to us.
Hi, everybody. So as Dr. Laguna said, what we tried to do was sort of batch the questions together, and this is sort of the $1,000,000 question. Just right off the bat, personally, I have 4 school-age children, so this is a discussion that happens every hourly in my house, every minute in my house, and we understand that there's a lot of personal feelings and maybe family drama behind this, and it's a hard question. But the most important thing that I want to say to everybody is it's an individual question for a family. We can give medical opinions. There can be opinions that are given by the schools and recommendations by the schools and different health organizations. But in the end, we really advocate for going with your family and deciding what's best for your family. What are the situations within your immediate family, with your extended family? What is the health and well-being of your family look like? And we just want to help you make those decisions in a unique way. And in an individual way. So the teams, I can speak for all of the CF care teams, that we are here for you to answer those questions, to look at everything on an individual basis, and to really get us through this time, understanding that it could change tomorrow. So with that being said, one of the bedrocks, I think, of our discussion and some of these questions is that where I come at this is from the numbers. And those numbers that I showed you before do support that our cystic fibrosis patients are not disproportionately affected by COVID. So really the theme of this is that what you would do for your family and your children should be similar to what you would do for your CF child. So let's get to some of the questions. Some doctors seem to be giving a blanket no school. Is this what the CF Foundation recommends, or is it a case-by-case basis? And I think Dr. Laguna went over that. It is absolutely the safest option to be in a remote setting, but there are downsides to being in a remote setting, and we have to take those benefits and risks together. And so by no means are we giving a blanket, no one goes to school in person, and we want to address this on a case-by-case basis. Should we get our own supplies and send our kids to school with their own supplies, and what should those supplies be? This is another that's by the school. My children, I have 4 Chicago public school kids. We always send them with their own supplies. That is the method that they get supplied in Chicago public schools. So that's really an individual decision based on what your school district is doing. but do we think that there's additional supplies that your CF child would need compared to other children? At this time, we don't see that. Should I be worried about my child going back to school? I think this is a question that everybody has. I see about 100 kids in clinic a week. I would tell you it's almost right down the middle. 50% want their kids back in person and 50% would never think about sending their kids back in school. And so I think everybody has that worry on, and there's no necessarily right answer to address that worry. But we do see from the data that thank goodness that this disease really does spare children and young people. How can I keep my child healthy once they go back to school? It's hand washing, hand washing, hand washing, wear the masks, do the things that we do for all of the other kids. And by all means, if there's any change in clinical status, as always call your CF team. We want to jump on any small exacerbation or small viral illness very quickly and address those very quickly with your family, and whether that be virtually or in person. What questions should I make sure I ask my school before I consider my child going back? And for those in public school, what should we do with their 504s? So I think that everyone should individually talk to their team members about, and the social worker or your health coordinator, whoever does your 504s and helps you with those, and make sure that they are appropriate and up to date. Again, we don't think that children with cystic fibrosis will need measures for safety that are different than other children or that are initially outlined in their 504s, but it's a great opportunity to make sure those 504s are up to date. And what do I do? What do I need if my school, if I don't want to send my child back? Do I need a note from the doctor? Again, this is individual school based. I can speak for myself, but I'm sure the team as well, is that if the decision is made by your family to not send your child to school and opt for remote learning, if a note is needed, I'm sure the teams will be more than happy to oblige with that. For preschoolers, is the risk and benefit worth sending since it's more socialization than content? Let me tell you the difference between your first child going to preschool and your fourth child going to preschool. By the time my fourth child went to preschool, I was hoping that they would take him at 18 months, frankly. And so that's just really an individual discussion. If your family is lucky enough to be able to have options where they can keep your child at home, then that's a family-based decision. But we don't want to give I don't want to give a blanket recommendation about preschool, because we understand that there's families that need preschool to be able for parents to go to work. And whether it's preschool or daycare, that's an individual decision for families and what they can handle. But we do not think a CF patient is more at risk being at preschool than another preschooler. What happens if 3 to 6 feet is not feasible? Again, this is a general question for all children and what all the school systems are trying to address. Like Dr. Laguna said, there can be inventive ways to get around this, outside smaller classes, and all the schools are working with them. As a teacher, I'm concerned about being exposed and exposing my son. What do you recommend? My husband's a first responder. This is another question that really addresses the family system as a whole. I believe personally that if teachers are concerned and don't want to go back and they have health concerns or reasons, that they should be allowed to opt for remote learning. But again, that's something that goes to the school district, and we can't really dictate that. But if we're talking about the child individually and how it affects the child, I and the CF teams are not concerned that if you work and you come back and you take and your family is going to be at increased risk for having an illness from COVID for your CF patient. Many families with CF have worked through this entire pandemic, and we're still seeing numbers that are very, very low. And the last question I'm going to punt to somebody else, since it's somebody from my team. So we have a great care team and advocate. Thank you very much who posed the question. But can you share any additional resources for social emotional skills that we can provide our child while staying at home? I wish I had more information for that. I don't. I think I'm going to direct you more to what we would do for the team as a whole and to your own, for our team, for our social workers helping with this. It is very difficult to keep kids engaged while they're home, especially families that need to go to work. And I think that is one of the reasons why the American Academy of Pediatrics really is advocating for the in-person learning the best we can. But I think that there's a lot of inventive and innovative things that are going on right now regarding social emotional skills that can be built. And I think it's about staying tuned, looking on the internet for those types of information. Parent groups are the best way to support this. And I think that, again, the most important thing is our CF kids in the end are just kids, and they need the same love and care and emotional support as any other kid. And so we don't want to single them out as needing anything more or less than anybody else. And that's going to allow them to really live their life in the most normal way. I think that's it for questions for me.
Awesome. Thank you, Dr. Watts. We'll now turn it over to Dr. Terry Laguna to answer questions about handling the transmission of COVID-19.
All right, I'm going to try to get through these pretty quickly so we can try to have a couple minutes at the end for some question and answer. So I'll read through these and then just kind of give a blanket answer to some of them. So there's lots of chatter about incident rates. Is it low in people with CF because they're being careful about quarantining more than the general population? Confusion was less likely of getting it, and CF people handling it better than anticipated. I think Dr. Watts has very effectively answered that with the data to show that kids with CF are just not getting it, and neither are adults with CF. How likely is it for my child to get the virus? Again, your child with CF is similar to any child out there. So they are at risk just like any of us are at risk in terms of getting the virus. So the same types of masking, hand washing, physical distancing, those types of things. Have you seen evidence that children can be asymptomatic and spread the virus more easily to others? I'm concerned that even if children aren't as impacted, that they could bring the virus home and infect others in the family. So I'm going to answer that one with the one after the next one, which is, has there been data to show that kids are carriers of the virus and pass it along to adults, even though they aren't getting sick as often as other people? So we don't have a ton of data to help us answer this question. However, there is one study that has recently been published out of South Korea that basically has looked at people who have gotten COVID-19, and they've done contact tracing and looked in the households to see, does it matter how old you are when you have COVID-19 and how easily you transmit it to other people? So this study has been frequently cited on CNN, MSNBC, all the local news and national news channels. So what this study has shown us is that kids that are 0 to 10, so kids that are less than 10 years of age, tend not to transmit the virus as easily as kids 10 to 19. So if you have a younger child, they tend to not spread it as easily, whether it's because they have a lesser burden of virus, or for whatever reason, we don't quite have that information yet. But kids that are younger tend not to transmit it as easily as kids that are older. It doesn't mean they still can't transmit it. It just means it happens less when they are younger. However, kids that are 10 to 19, and I think Dr. Watts talked to us a little bit about the less than 25-year-old age range, they can transmit it just like adults. So the younger you are, the less likely you are to transmit it for reasons that we don't quite know just yet, but older kids can absolutely transmit it just like adults can. Is there a threshold of rising cases that would warrant pulling kids out of school? So living in Illinois and living in Chicago, you will hear about percent positivity. You'll hear about the number of cases and how quickly they're rising. Our local and state government has been very good at watching those numbers and will inform us when we get to a time when we need to think about pulling things back. So that is not necessarily, that we are getting data to help us make those decisions. And then finally, what precautions could CF adults be taking with school-age kids so they continue keeping their kids at home so they don't run the risk of getting sick? Again, I think this is a situation where a discussion with your care team, I think, makes the most sense, because it's a specific question about how do you decrease your risk of your children transmitting the virus to you. Next slide. Okay.
So thank you, Dr. Laguna. Now we'll go on to Dr. Giles to address masks, supplies, and equipment.
So I was asked to speak with the mask, supplies, and equipment questions, and I think I answered in my first part about, do our kids have to have N95s? The answer is no. Cloth masks are definitely sufficient. And it doesn't matter with the filters. The only time you really truly need the filter is, as I pointed out, if you've got the exhalation valves. Those ones definitely need filters. What's more important is that there's 2 layers, it's comfortable, and they're going to keep it on for the day. And really nothing else truly matters other than that. Thoughts about nebulizers and inhalers at school. Nebulizers, we know, spread things more out into the environment, way more so than inhalers do. So when the pandemic first started, all the hospitals were scrambling to eliminate the use of nebulizers in the hospitals because we knew that they were going to help with the spread of COVID. And there's really no data to sit there and say that that's not true. So we are still trying to minimize as much as possible the use of nebulizers. At home, without any other people around, is fine. At school, though, I'd probably just stick with the regular inhalers. If the child cannot do an inhaler, then the nebulizer can be used, but they should be in a room with no other people around, and the room should not be used. It should be cleaned down afterwards and probably not used for about an hour after the child's used the nebulizer.
Awesome. Thank you, Dr. Giles. Now we'll move on to Dr. Dowell to answer any other questions regarding COVID-19 vaccine.
Dr.
everybody
Dowell, you're
hear?
muted.
But I am muted. Apologize.
There you are.
Do we have any thoughts on when we might see a vaccine? I was saying that a safe and effective vaccine really can't come soon enough. I think it would be premature to give you a date. I wish I could, but I will say in the new year we should have a lot better idea, much better idea about where we stand. And I will say there is a lot of forward progress and some very good results coming out. So will folks with CF be given priority for the vaccine? This is not known. I think as it comes out, its safety profile, its effectiveness, who are the highest risk populations, those kind of things will probably play out, but we have no information at this point about who's given priority and who isn't. If you think about it, there won't be a vaccine available for everybody on the planet when it does evolve, even though they're ahead of the game with the at-risk approach of manufacturing ahead of time. I think some of the first batches will be in the 100 million dose kind of thing, with options for 500 million doses coming out. So once it's hit upon the correct thing, the manufacturing will step up in a rapid way. And there may not be, there may be more than one too. So the priority, it's a long-winded answer to say we don't know about the priority just yet. And then I think I did the please provide an overview on the progress toward a new vaccine. My last comment in the interest of time will be, in the meantime, please get your flu shot. We don't want to get into a position where we have flu overlapping with COVID. That would be particularly challenging. And I'll expand it to also say your regular vaccinations are really important too. You don't want outbreaks of pertussis and all sorts of other things at the same time. So that's my plug for protecting yourself. Protect yourself with what we know works and move forward.
Awesome. Thank you, Dr. Dowell. It looks like we might have a few questions in the chat feature, so let me switch over to that. Meg, have you been monitoring the questions, or?
Yeah, so the one question from Tracy is, how likely is there bacteria that forms in the masks as the CF patients wear them all day at school?
That's a great question, and the realistic answer is I don't know. But we do recommend that if you've been wearing the mask all day, that you come home and you wash it. It does not need to go into a washing machine. Hot water and soap is all that you need. And that should be fine. If you're worried that if you're worried about that, then they can maybe switch their mask out halfway through the day, as long as the mask that they've been wearing goes into a plastic bag to go home and to be washed. But the mask should be washed every day.
Great. And then there's a question from Allison. If we think our child with CF has symptoms of COVID-19, should we contact the CF clinic first for testing approval? Testing in our immediate area is limited to people who have a doctor's referral. And then the second part of that question is, are there any COVID-19 symptoms that seem to be more prominent or unique for CF patients?
I can take that one. So I mean, in Illinois, every person should have access to a test. And so the Illinois Department of Health, if you look on their website, has a listing of all of the testing stations and where they're located. And you do not need, anyone can go and get a test. So that is option number one. Option number two is if somebody is symptomatic and has symptoms, then going to your primary care doctor, your primary care pediatrician, family practitioner, APN, you should be able to get access to a test. In the setting of symptoms, going to a healthcare provider's office should provide you with a test. At Lurie Children's, we have a number of testing sites. They are more local than they are out in different areas of Illinois. So we do have access to be able to get you an appointment at a Lurie site if you are able to get to one of those. So I think that there should be options no matter where you live in getting a COVID test. Now, how rapidly those test results come back may vary. And you also want to make sure, if you can, that you have a test that's a PCR-based test. There's a number of different tests that have different false negative or false positive rates. So if you have a choice, you really want to get the PCR. P as in Paul, C as in Charlie, R as in Rainbow. That's the most sensitive and specific test for COVID-19. And then the last part of the question, are there any COVID-19 symptoms any more prominent or unique for CF patients? Not at all. Unfortunately, the virus isn't different depending on who it infects. So it's the same kind of fever, cough. I know in little kids may be hard to see for them to express the loss of taste or the loss of smell. That seems to be pretty prominent, but really it's fever and cough.
Thank you, Dr. Laguna. The next question is, does 6 feet apart but in the same classroom for a full school day still make a difference?
So I think when we talk about the details of what that classroom environment looks like, it really is going to be individual to what the classroom is. 6 feet apart in the same classroom, eventually someone has to go to the bathroom. Somebody's going to be getting out in the hallways. I know that the schools are really working towards limiting the capacity so that their passing periods are less often, working in pods. So there's a lot of work being done at the local level to try to figure out how to reduce the exposure of kids to other kids. That'll also allow for easier methods of contact tracing. But I don't think that if someone had said, my school is going back and they're staying in one room versus they have to move from one room to the next room, that would make a difference to the health of the child.
Great. Next question. How high of a fever should we look out for in children before we consider the possibility of it being COVID?
I can take that one. We're looking for a fever of 38.5 Celsius. I think that translates out to about 101 Fahrenheit. And that's when that's one of the 3 cardinal symptoms of COVID infection. But again, it could be any symptoms, and a lot of children are asymptomatic. So a fever alone is not COVID until they're tested.
Awesome. Well, thank you. It looks like we are just we've gotten to all the questions that have come in through the chat feature. I'd like to thank our panelists again for all the information that you just shared. And thank you to everybody in the CF community that has joined today's call. We really appreciate, even though I can't see you in person, it's nice to have you here. I want to make sure you stay tuned for more information regarding our August Town Hall focusing on telemedicine and other CF virtual engagement events that are coming down the pipeline. So make sure to follow us on our Facebook page and social media platforms, because that's where the most current information is being sent out from the foundation. But again, thank you to all the physicians that attended today and participated, and thank you again. We'll see you soon.
Thanks, David. Thanks, everyone.
Thank you, everybody. Good to see you.
Thank you.
How we can help support you.
Take care. Bye-bye.